All right, folks. Hey, let's talk about Aljamain Sterling. Aljamain Sterling. He's Jamaican, but he doesn't have the accent, and that was the worst Jamaican accent ever. Anyway, as you guys know, if you know who he is, he pulled out of the fight that was supposed to happen at the end of this month, right? And, you know, he had fusion of his neck. He had a surgery on his neck, an ACDF, an anterior cervical discectomy and fusion. That means that they had to remove the disc and put in an implant, put in some bone graft, probably held it with some screws. He sometimes put a metal plate on it to fuse that part of the neck. When you're doing that, you're also decompressing the nerves that are being pinched by any disc herniation that's there. Now, it's not a big surgery.
What's going on?
What in the?
Okay,
Come on, hey, dude.
You know,
It's my day for the show.
what is this? Is this a pocket square?
I'm in the middle of something. I'm talking about spine. What do you know about
is this
spine? Why
a
you
suit?
interrupted me, man?
What's with the suit? Like, what are you talking about? You're talking about spine? Like, what do you? I don't get it. Like,
You believe this guy?
We don't do spine here.
Why don't you talk to
Where's
us
your
about?
mask?
Why don't you talk? Why don't you talk to us?
Where's your
Why don't you talk to us about cervical spine surgery, Mr. Sports Guy?
This guy.
Good to see you, man.
You do. There's no camera there. Did you know?
Exactly. Yeah. Anyway, back to what we're talking about. Okay, so he had an anterior cervical discectomy and fusion. I think it was C6-7, right? So that's between the 6th and 7th vertebrae. Again, what they're doing is taking out that disc that's there, decompressing the area where the nerves come out, because the nerves come out from the spine, go into your brachial plexus, go into your upper extremities. So it's the surgery doesn't take quite that long. You know, usually you can get these done in about an hour. They're done outpatient, and people do really well with these. You know, so almost 100% of them fuse. The problems happen in people who are cigarette smokers. Okay, so if you want bones to heal, don't smoke tobacco products. Unfortunately, that's an issue. It's the nicotine that does something. But you know, like I said, almost 100% of these heal. So why did he pull out? Well, let's think about this. So whenever I do any kind of surgery on a patient, a fusion surgery, it takes about 3 months for the bone to heal, right? But bone is something that is alive. It remodels. So I always tell my patients that we're not going to know exactly how you're going to be until a year after surgery, because things can keep remodeling. Bone can keep remodeling. You have to go through rehab, and that's just a general rule, right? So it's not to say that the person's in pain or not functional and so forth. I just say that that's about the time when we know how things are going to be, right? At that point, there's not going to be much more improvement. So here's possible scenarios, right? So either the bone didn't fuse, which means they're giving more time for it to fuse, but I don't think that's likely. Like I said, most of these anterior cervical discectomies and fusions actually work. The person has a bone that has the two bones fused together. What I think more likely happened is, or maybe happening is, when I do these surgeries, I tell people to kind of take it easy for about 3 months. Okay, so 6 weeks. I don't usually put people in braces after the surgery, but for about 6 weeks, I'm gonna have them take it easy. They might start physical therapy at 6 weeks, where they're doing some gentle range of motion exercises, passive and active. And at the 3-month mark, if I look at the X-rays, and it looks like they're solidly fused at that point, I let them get back to doing what they do gradually, right? So, I've talked about athletes kind of being superhuman. Their bones still heal the same. It still takes the same amount of time for their bone to heal. They might be able to condition faster or recover faster because they're in such tip-top shape. But I can imagine that his surgeon probably wasn't going to let him get back to training the way somebody would for a fight, like he was going to be fighting at the end of this month, until 3 months after surgery. And how long do these guys train for a big fight? Probably 3 months. So surgery was in April, May, June. So he had July and August, maybe September, to train for this fight. Was that enough? Maybe not. Maybe that's why he pulled out. He could still have some lingering issues because it is surgery still. He still could have a stiff neck. And this thing was bothering him for a while. That's why he ended up having surgery. So I'm speculating. And guys, people beat me up on this channel saying, "Oh, it's all speculation. You don't have the facts, blah, blah." This is all entertainment, So I'm giving you what I think probably happened with this individual. If it was my patient, I'd have a lot more information, but I'd never be able to share it with you because of a certain thing called the HIPAA, right? So I'm speculating about this is what happened to this fighter. So he pulled out, likely because he needs a little more rehab on his neck before he gets back into the octagon. That's what happened. Now, there's another famous athlete who had an anterior cervical discectomy infusion and ended up going and doing really well afterwards. Peyton Manning, remember? He had that, but he had an entire season off to recover. So he had that year. So he fused and was able to get back. He was able to rehab. He was able to get back into tip-top shape over a long period of months and then get back playing the NFL. Unfortunately, these fighters don't get paid as much as people think they do, right? Even champions, right? So you hear some of the big names, you'll see them driving around with fancy cars and they have mansions and so forth, but it took them a while to get there. And there's not that many of them who are getting paid like that, right? Why do you think some of them want to go and fight this YouTube guy so they can get a paycheck? They were champions at one point. You would think they have a lot of money. Yeah. Maybe he does. But I think that for fighters, they have a short career, and they have to maximize as much as they can that career. They have to fight smart, but they also have to fight more, or they have to participate in these things much more frequently, and it's much more violent than any other sport out there. So he didn't have a year to cover like the football player did. And I blame him for pulling out of a fight so that he can make sure he's in tip-top shape before he goes in there? Yeah, because if you lose a fight, that might be it for you, right? Anyway, there you go. Now, I did months ago do a story about a hockey player, Eichel, remember? He wanted to have a cervical disc replacement, and I said, I don't know anybody who would be doing these in a professional athlete, because especially hockey, football, some of these high impact contact sports. And it actually turns out that I was wrong. So see, I actually reached out and looked at what other surgeons were doing, and it turns out there's a guy named Chris Weidman. Remember him? He had an he didn't have an anterior cervical discectomy infusion. He had a cervical disc replacement, believe in 2019. And he came back and he fought in 2020 and won a fight after that. He later fractured the tibia in a different fight, but that has nothing to do with his neck. So it looks like you can do these in these these elite athletes who are in sports that are quite hard on the body. I also have a good friend who is at the Virginia Spine Institute. Shout out to Dr. Christopher Good. He has been doing cervical disc replacement in athletes. If you are interested in that and you're on the East Coast, Christopher Good. I haven't done one in a professional athlete. Will I at some point? Well, if a professional athlete comes to me and I see that there's enough data, it looks like there's data coming to support it, maybe. But looks like it's been done and looks like people are doing okay with it. So I stand corrected. It looks like you can do cervical disc replacements in elite athletes in contact sports. There you go.